Was he born with it, or is it a hair transplant? Only a physician's going to know for sure.
Welcome to this episode of the American Medical Podcast with our host, Dr. Michael Kanosky, a board-certified plastic surgeon, hair restoration specialist, and medical director of AMP Mississippi.
Well, today's hair transplants look so real because it is real. It's your hair. What we use today is called the NeoGraft follicular unit extraction. We're able to take an instrument and take a microscopic teeny little plug of follicle, and we take some of them from an area, and we're able to transplant that tiny little microscopic plug. You really almost can't see it with your eyes. We have to use special magnifying glasses, and we're able to transplant it where we want it. Here's a picture of a gentleman at the time of the surgery where he has the hair that's been harvested, the plugs, and they are then about 2 weeks after, his hair grows back, and you're not even ever going to know that he had anything taken or removed. The little tiny plugs of tissue, the follicular units, are so tiny that no scar is produced. So you don't have to worry about that big, heavy, thick scar or a lot of pain and tenderness. When I do these types of procedures, most of our patients will take a pain tablet or two, but little else. And also we're able to do this type of procedure under local anesthesia now so that you don't have to go to sleep. You don't feel groggy after. Within a day or two, you're able to go back and lead your life normally. Next pair, let's take a look at our next slide. This is a gentleman who's going to be having a follicular unit extraction transplant. What we do, first of all, is mark out the areas that we're going to put the transplants in. For example, this gentleman that you see has an area in the temple, but also in the frontal area where everything has become thin. His hairline is marched back. He's got the high forehead. So after we mark the patient out, we take the patient to the procedure room. We shave his donor site. What that means is we give you a crew cut in that little area where we're going to get our hairs from. Next slide. After that, what we do is we harvest with our special tools these little tiny micro plugs, and this is a picture of them on the right, these separate follicular units. This is what they look like under a microscope. And if you'll notice, they come with a tiny little button on the bottom. That's where the hair follicle is. Just a tiny little bit of skin tissue, just almost invisible, and then the shaft of the hair, which is all protein. Next one. After we're finished with that, we take the patient, and in the same setting, at the same time, we actually put the little tiny implants in where someone needs it. Now, the gentleman on the right, you see the little red areas, looks like a sunburn. That's where the tiny little plugs are going. He's going to look like he's had a sunburn in those areas, that's all. On the right side, under a magnifying glass, we actually take a look at what the hairs look like. They look like tiny little plugs that we have put in. They have almost a waffle type appearance for the first 24 hours. And then after that, it smooths out. Next pair. Let's see, next slide. Okay, let's show you a gentleman here who's had a major transplant. This gentleman has very advanced male pattern balding, and his hair follicles in this entire front and top area are gone. We can't revive them with the other techniques, so he needs a transplant. This is him pre-operatively. He walks in the morning. Next slide. This is him post-operatively. This is at the end of the procedure. He looks like he has a sunburn on the front. The hair follicles are so tiny you really can't see with the naked eye the individual hairs at this point. The third is 1 month later when the hair follicles begin to grow, and you can notice here that he's got a fine stubble. And then finally, number 4 is 9 months later. This is when he's growing hair. And this is the result. And for a gentleman with this major hair loss, this is a very, very good result for him. He was very pleased with the result. Next slide. Okay. And let's take a look at some before and after pictures, some patients of ours that we've had the opportunity to treat over the years. First of all, this is about 2,000 grafts. This is a very common number that we need. Now, that's not 2,000 hairs. Sometimes there's 1 or 2, sometimes even 3 hairs in one tiny little plug. But here you have someone who's, first of all, he's showing you the front, and then from the back, he's showing you the crown or the top of the scalp. And this is about a year later, because it takes a full year for the hair to grow back. And you see his results before and after. And I think the results are really, really great, and he was very happy with the result. Slide there. Okay, here's a gentleman, very similar problem. You see a lot of younger guys in particular with that thin, fine, wispy hair in the front. That's what this gentleman has all through the frontal area, back to the crown. And on the right side, you see a photo from the back side, and we're able to show you before and after 2,000 grafts 1 year. So once again, excellent result. Gentleman was very pleased with his result. And here's a lady who had very advanced hair loss. On the left, you see the front, and on the right side, I just wanted to show you another frontal view, and from the side to a degree, because it really demonstrates how badly thin her hair had gotten. And this was her after 2,000 grafts 1 year later. And she was extremely pleased with the hair restoration. And then next slide. Wanted to tell you that we could even contour this technique to special areas. For example, we see patients for whatever reason that may lose the temple hair or just have a receding hairline. Here's a lady with a high hairline and no temples left. We were able to concentrate on that area in the front to lower her hair, frontal hairline, and also on the temple. And now she has, as you see, 9 months later, a full temple and a normal frontal hairline. And so we can contour this extremely well for different patients. Finally, let's show the next graph. This is a patient, we see this in a lot of ladies. Not massive loss, but sometimes spot areas that get ultra thin. And we're able to concentrate on providing hair just to that one area. And this is a lady with 850 grafts, about 18 months later, and she's thick, heavy. I'm very pleased with the result because she says she can wear her hair the way she wants to, the way she used to some years ago. One of the things we tell people that's so great about this technique is we can adapt this technique to whatever your hair loss pattern is. Whereas in the past, with previous techniques, it was mostly a one-size-fits-all, and not everybody got the same result. And I want to stress, all of these procedures are all done under local anesthesia. That's numbing medicine, very similar to what you get when you go to the dentist. These patients don't need heavy sedation, and they're able to walk out of the office fully awake that day, watch television that night, spend a day or two at home, light duties and activities, and then go about their business normally. And once the hair grows back, it's your hair. And you don't have to do anything special to it. Just treat it like you normally would with whatever shampoo and conditioner you would normally use, and go about your business and live your life. So it's a tremendous advancement of over what we had a few years ago. Now let's go to future treatments. This slide shows some really exciting things that are either just here or are going to be here in the near future. It's going to be some really great opportunities for hair restoration. One of the most exciting things that is now on the market is the use of stem cells. These are what we call baby or primitive cells in our body that are held in reserve by the body to help repair tissue damage. We've all got them. Unfortunately, as we grow older, the supply of stem cells gets less and less and less. So a child has a lot more than a young adult, who has a lot more than an older person. Well, we have found that if you can harvest some of these stem cells and then use them and inject them, that actually tremendously invigorates the hair follicles to regrow. Because these cells are what we call undifferentiated, they can become anything, a kidney cell, a liver cell, they can become a cell in the eye or a fingertip cell. We can allow them to become the kinds of cells that produce hair if we put them in the right place. And this is a new technique, and injecting stem cells is going to be a really exciting advance and something that's going to help a lot of people. Another thing is the use of peptides. Peptides are amino acids or proteins, and coupled with things such as copper and iron, we're able to use them on the scalp to greatly stimulate the growth and rate of growth of hair. And so using those are becoming very important. We've got the use of cyclosporin A, which is an anti-inflammatory medicine, and it shows great promise for those people who are losing their hair because of severe inflammation or scarring, which is a bad problem for many patients, particularly a lot of ladies. And the use of cyclosporin, I believe, is going to become quite commonplace in the near future. We also have new things such as manipulation with genes. This is where we're going to be able to genetically manipulate some of the genes, perhaps turn off the genes or alter the genes that cause hair loss. We talk about genes being the most important thing and the reason why we lose our hair in the first place. And so it's going to be really exciting if we can start treatments that will manipulate those genes and prevent the hair loss from ever occurring. And finally, out on the horizon a little bit, perhaps a few years, is one of the most exciting techniques that I think will revolutionize our area of medicine, and that is the use of cloning technology, where we'll be able to harvest one of your cells, clone it, make 1,000 of them, and then use it for a hair transplant. A lot of companies are working on it right now. It shows a lot of promise, something that possibly will be with us in 5 to 10 years, and so it'll be on the horizon. We're looking forward to see how that develops. There's a lot of exciting and new technology. Please avail yourself of it. Don't feel that you're alone, that you've got to lose your hair, that you've got to look older because of it. Both men and women have a lot of problems with hair loss. We're here to help you. We want to talk with you, let you come in, develop a plan that's tailored to your needs, and see how we can get some of that hair back for you. If you have any questions, please don't hesitate to call us. We love to chat with our patients, and thanks for tuning in to listen to us today. Thanks.
To hear more episodes of the American Medical Podcast with Dr. Kanosky and his medical and wellness guests, follow us online. American Medical Podcasts, amplifying health and wellness.